On this edition of Focus on Health, we will be discussing such an important topic, dementia, what you need to know and what you need to do. Join us on Focus on Health. Welcome to Focus on Health. My name is Dr. Asante Hiltz, and I'm your host for Focus on Health, and I'm so excited for this month's topic. Today we're talking about dementia, and I'm joined today with a very, very special guest from the Area Agency on Aging, Ms. Robbie Monfort, who is a dementia care specialist. So Robbie, tell us a little bit about yourself and introduce us.
As you said, I am a dementia care specialist. I'm very honored to be here today and very excited to be able to get this message out. I have a long history of working with the elderly, and when this position came open 2.5 years ago, I really wasn't real clear. I don't think any of us were, because it was a new position, and we were building the program. So as a dementia care specialist, we have 12 regions in the state. And so there is a dementia care specialist in each region. And so our goals are to educate the communities, partner with the communities, with stakeholders, businesses, anybody that will partner with us to get the word out, and to support those with the disease and the caregivers. So that's kind of an overall view of the purpose of the position and what we do. And of course I work with the Area Agency on Aging, who is a beautiful mesh, because a lot of the resources that the ADRC offers, in-home health, ADLs, Meals on Wheels, those kind of things, are some of the resources that people with dementia or caring for dementia, someone with dementia, need. So, but I'm unique in that I do work with those that are 65 and older, but from a dementia perspective, you're really working with anybody that's involved with someone who has the disease. It could be a child, it could be a sister, it could be a brother, it could be your mother. And so that's any age group, because children who go visit grandmother, why doesn't she know who I am? So I'm unique in that I do educate anybody who's willing to listen.
And I want to say this too, that you are a unique guest, because those of you who are watching know that we always dedicate our show to former council member Pop Barnes. This was his show, and we're carrying on his legacy. And when I invited you to be on the show, you said something very special about Pop Barnes, and I want you to share that with those who are watching today.
Well, immediately I just had emotion. Pop came to me when this position was put into place and I was hired, and from the get-go was a huge advocate. He's been through my he had been through my virtual dementia class, and he wanted to do anything that I was offering. And you know, with the River Valley, he was the chair of the commission, and he was on the AAA Advisory Council. His heart was for people, and he really wanted to see this program flourish and to get this message out. And I'm just honored to be able to be here on his show and to be able to share that with the public like he wanted it to be done.
And I'm so glad that you're here, because Pop actually told Robbie that he wanted her to be on the show,
Yes.
and that never happened, so we're making it happen today. And in his legacy, he wants us to focus on the things that impact the health of our community in the Chattahoochee Valley. And we know that dementia impacts us. And so I want to talk to you about what dementia is. You know, those who are watching, we may have an idea of what dementia is, and sometimes we confuse it with Alzheimer's. So just give us a basic definition of what is dementia.
Well, I love that you said that. It's often confused with Alzheimer's, and it is a type, Alzheimer's is a type of dementia. So dementia is a set of symptoms. And so based on the symptoms, then you are diagnosed with the type of dementia. This is usually done with a neurologist and a psychologist who does psychological testing to focus on what type of dementia it might be. And so there's up to 100 types of dementia, and most people do not know that. We hear the confusion with Alzheimer's because it is the one we most often are diagnosing and the one that we know most about. But you have frontal temporal lobe, that's Bruce Willis, Lewy body, that was Robin Williams, you know, and if you go Google who's had dementia, you would be amazed over the years, but we don't talk about it. And so that's the whole thing is, why are we not talking about this disease any more than we would cancer or high blood pressure or diabetes? So dementia is a set of symptoms, to summarize your question. And based on those symptoms, with the diagnosing process, and I forgot to mention MRIs, CT scans, spinal taps. There are multiple tests that the neurologist would do. Then you're diagnosed with dementia of the Alzheimer's type, or dementia of the Lewy body type, or dementia. So based on what your symptoms are.
So since you're talking about symptoms, because some of us just don't know what those symptoms are, tell us what symptoms should we be paying attention to for ourselves or for our loved one to understand, hey, is this dementia? Should I be asking my doctor about this? What symptoms should we look for?
So this one's kind of a tricky one. That's the reason we want to educate people about the disease, because we all immediately go to memory. It's a memory issue. Well, yes, it is, and that is a symptom, but we have people who their vision was their symptom, initial symptom. We have people who their initial symptom's hearing. So with Alzheimer's in particular, we're talking about your memory, your vision, your smell, your taste, your hearing, your fine motor skills. So if you don't really understand the different diseases with the different symptoms, you know, you could have somebody that's repeating to say, I didn't hear what you said. And you're going to go automatically to say, is this a hearing issue? Or, you know, you come home and you've bumped your car and you're really a good driver. And so a couple of months later, you bump your car again. And your husband goes, honey, what's going on? So it affects your peripheral vision. So when you're looking to back up or to the side, depending on the stage you're in, your peripheral vision closes in. So my food doesn't taste good anymore. You know, but we all go to the other things we're looking for from a medical perspective. The key there is that when they don't find anything wrong with your optometrist says everything's fine, I don't see anything wrong, then we might go, okay, this is happening, we might need to look a little farther. And if you're aware of the disease, you might go, I wonder if something's going on. We just need to get this checked out.
And that's the take-home message that I'm hearing from you, Robbie, is that when there's a collection of symptoms, multiple
or
things,
just one
symptom, we need to pay attention when something's different or changing.
Yes.
And talk to our medical provider. So you all know, we say on Focus on Health, this is not a show to diagnose disease.
Right.
It's an opportunity for us to talk about it, recognize if something's wrong and not right, so we can get ahead of it. Now, so can I ask you a question about prevention? Because we focus on prevention. Can dementia be prevented?
You know, yes. But are we willing to do that? Meaning, we want to diet, we want to get healthy, we want to do that. Well, one of the things you do for prevention is, you know, you change your diet. You eat healthy, you do a Mediterranean diet, you exercise, you learn new things. So if you're not somebody that loves to try to do different things, You're not going to just start doing it. So, but there are ways, and if you're motivated enough, just like with diabetes or something else where you have to change your lifestyle, then yes, you can make changes to help prevent, or even that maybe it's later if you have the gene, and it's going to happen anyway. But the healthier lifestyle you live, the more interested you are in learning. 5 or 6 things that you can do: the diet, the learning new things, making sure you're healthy. You don't want any comorbidities. Those are huge issues. So, yes, there are things you can do to help slow down or prevent.
And you mentioned the gene. So who is affected by dementia? Is it for all of us who could potentially have it? Are there certain people, certain ages? Give us some idea of who this impacts the most.
Okay, so interestingly enough, if you have the gene, it doesn't necessarily mean you're going to get it. If you have it in your family, doesn't necessarily mean you're going to get it. But that should be a red flag. That should be, you should be the one going, oh, something's different, I need to go to the doctor, I need to get this checked out. But anybody can get the disease. It does not discriminate in any way. They're diagnosing people in their late 30s and up, so it's not necessarily an old person's disease anymore. We're learning more and more. You have, and that's called young onset, but you have early onset before 65, and then you've got all the different types that are out there now. So it's not discriminatory. Anybody can get the disease, which is why we need to know that it's there. It's like if you have cancer and you feel a lump, you know to go check. So if you know about the disease, you'll go check. So based on who, the African American population is the #1 population for getting the disease, for being diagnosed. And typically that is, education, that is lack of medical attention, that is comorbidities. Those are the things that we think are attributing to that. And then the Hispanic is the #2 population, and then the rest of us follow suit after that. So it's really important that those populations understand, because, and I want to back up, I don't want to throw off what you asked me, but research is really important there, in that those are also some of the populations that we're not getting the research in to know what's going to help those populations. We do have medications now, but the majority of the research has been on the Caucasian population. So it's really important that we all give back to be able to do our part in helping the next generation or our own family, whoever it is.
And what about the gene? Can we go and ask our primary care provider to get a test for the gene?
There is a test for the gene. It is blood work. Not all labs are set up to do that. And so yes, so I'm going to advocate here for you to talk to your primary care doctor about saying, I'm concerned about things I'm doing. I want to know that I'm okay. So that's one way, is you're being proactive to see if you're in trouble there. Can we test for the gene? Can we do an MRI to see if I have tau protein? I think with this disease, we have to be our own best advocate.
And that's advocacy is our primary objective, advocating for ourselves, advocating for each other, advocating for our loved ones. So we're here with Robbie talking about dementia. We've learned so much already. Dementia can be prevented or can be slowed down with our diet and our lifestyle changes. We need to pay attention to our bodies and anything changing that's abnormal, and have that conversation with our primary care doctor or our provider. That means we have to have normal checkups to have those conversations. And there is a test for that gene. So we've learned so much already, and there's more to come. We're going to go on a quick break, and then we'll be back to speak to Robbie more about dementia.
If you're living with HIV and not in care, there's help. The Linkage to Care program of the West Central Health District connects newly and previously diagnosed HIV-positive individuals to HIV medical care. We can help you develop a support plan to overcome the obstacles that keep you from treatment. and will get you on the road to living a healthier and fuller life. Wherever you are, we're here to help. So call today. Call 706-225-6381 or 706-505-0883.
And welcome back to Focus on Health. I'm Asante Hiltz, and I'm joined here today by Robbie Monfort, and we are discussing a very important topic, dementia. So Robbie, I want to just share with everybody that I met you because I work at Valley Healthcare System, and we had you come in to talk to our staff about dementia and how we can best interact with our patients who have dementia. So I want to talk to you now about, if somebody has dementia, what action items can we take? How can we get involved? How can loved ones support, and how can caregivers support? So talk to us about dementia and what that looks like in us being involved in the movement.
Well, I'm going to back that up with what you're saying and saying what you can do, but I'm going to give a few tips on what you can do in terms of a community who is, whether it's a church, whether it's your neighbor, whether it's your family member. We want people to understand that it is still the same person that was always there. That is one of the things I hope people can walk away with today, is that if you have cancer, you're no different. You're dealing with a disease. If you have dementia, you're still the person. You're dealing with the disease. And yes, it progresses and there are things that change, but often what we see and we think of are later stages. And what's important to know is that we want you to still be as active as you can be. Your family still needs to let you be you. You need people to see you. You need them to say, hello, how are you today? You need them to be at your level so they can see you if their peripheral vision's being affected. Meet them where they are. My favorite thing to say as people progress is, improv. Just go with them and have a great time. I typically walk out laughing because we've had a wonderful conversation. We've both had a good time talking, and they're happy. That's all we need to do, is let them feel seen, valued, and that's all we all want, whether we have the disease or not. So the respect and the dignity, this is something that we need to start talking about, and realizing that they need that to maintain as long as they can. Because when we don't allow them to do that, they decline.
And that encourages us as community members, as caregivers, as loved ones, when we're seeing a family member go through this change and this progression. Sometimes we just don't know how to react to them, how to still engage with them because they seem different. So if I'm looking at the early stages, before the person has the diagnosis.
Or even when they have early diagnosis.
Or early diagnosis. How can I be best supportive? Because I know that you mentioned before, the person may not recognize the change, but you as a loved one recognize the change, or you as a friend or a family member recognize the change. What should that family member be saying to the individual who may not know yet that there's something different?
Very important question. We typically, and I think it's just human nature, think that if we don't see anything happening, or if maybe there's been a little mess up or a faux pas, or we don't remember something, it's no big deal. And typically, we will all have memory issues. So I'm not saying everybody's going to get the disease. That is not what we're talking about here. But if you're having those kind of things happen, and people who are very close to you are noticing that something's out of line and this isn't you, and they eventually get the strength to say, I'm concerned, that we're willing to hear, and that doesn't mean you have to go, oh, okay, I'm going to go run to the doctor. That's not what I'm saying. But that you're willing to hear, I need to listen to what they're saying because I know I've forgotten a thing or two. You do this with yourself if you have to, and then begin to say, maybe I need to make sure everything's okay. So we really need to listen to the people around us because they're going to notice it probably quicker than we would identify it as something being wrong, okay, versus that we've just forgotten something.
Okay.
So, our village, and that's what I call those who care about us and love us or work with us, those are the ones that know us the best.
And they're the ones who are going to recognize the difference. Once that's recognized, once, let's say, we have had the support of our primary care provider, we have a diagnosis, are the medications proven to be effective if someone chooses to get a medication regimen during their dementia journey?
Okay, so there's medications that are used early on, Namenda and Aricept, and they've been around for a very long time. Quite often, if there are issues of agitation, anxiety, there's those medications as well. I am not a physician, let me be clear with that. But these are things that often are used. Today's teachings and my certifications are saying that we want to be person-centered and we don't want to go straight to medications. That is not what you want to do, because we have learned that a large percentage, and I'm talking about a very high percentage, of the agitation and the anxiety is either caused by the environment or the caregiver. And typically that's because we're trying to get them to do what they've always done, or we're trying to get them to do something the way we think they should do something. And their brain's not letting them do that anymore. And so they get agitated, or because they want to do this thing, or they simply can't. And so we have to tweak how we think about the disease, and those are my terms. The tweaking is that we then have to realize, okay, however you're doing, it's working for you, and if it's not hurting anybody and you're safe, we need to let it happen.
As you're talking, the word that's coming to my mind, I'm thinking, is empathy. And the best way for us to be empathetic is to learn about the disease. How can we interact best with our patient, with our mom or dad, with our loved one, with our child who's going through this dementia journey? What can we do, and how can we be best supportive? So now I want to talk to you just from a community standpoint. How can we get involved? What events are coming up? How can we get more training? Because we want to bring awareness and advocate just like you are.
Well, thank you for that. I do classes. I have the Rosalind Carter Institute Dealing with Dementia class coming up in November, and you have a flyer for that, and it is a 4-hour class, but I'm splitting this one into 2 hours, and it is for caregivers and anybody who is in the field that wants to learn how to deal with anything that comes along with the disease. It's like, it's a thick book that you get to take home with you. I relate to it like what to expect when you're expecting. That as a pregnant woman, you're looking, and once you've had the baby, it's like, what do I do if the temperature's 101? Well, nothing, it tells you. But when it gets here, you do this. So it's a guidebook for those who are caring for loved ones or anyone with the disease. I also do a Dementia Friends class, which I think is really important. I would love to do this anywhere anybody will open a door. I have done one at Synovus at the bank. They were extremely receptive. I do them at churches, civic clubs. I'm doing one at a tea this afternoon. I'll go anywhere. In this particular, I call it English 101, Dementia 101, that it's an overview on to help you really understand the disease and how you can be best with someone in your community and support them. I then have a senior, innovative senior care program that's a 12 series and each topic is different: language, communication, anxiety. So it focuses on specific things again that can be done. And so I have multiple classes. I do presentations. Any of those classes you can call the ADRC, River Valley, and just ask to speak to me as they come up. If I happen to be doing it at the library, I'll tell you to come on and join us. So it isn't like somebody may have asked me to go somewhere specific, and I'll do that with people who are interested in doing things that want to know what it is before they invite me in. I'll say, come here and watch it, so that people understand what it is. Because again, this disease is something that we sort of back off from, and we want to make sure that we understand before we bring it into a crowd. So I'm wide open to do that. If you want a class, all you got to do is ask.
Okay, and now how do we contact you?
Well, I'm at the River Valley Area Agency on Aging. The best way to get me is my phone number, 706-332-3267. And please leave a message, and I will get back with you as quickly as possible. I do some evenings, I do weekends. My whole goal is to touch everybody in my 16 counties. I cannot do it without y'all.
And we're here to support. We're here to learn. I want to thank you. You came to Valley Healthcare and you gave us the Friends of Dementia class, and we learned so much as caregivers who have patients who have dementia, as well as things we could take back to our own families. So thank you for being with us, Robbie. We thank you for joining us today on Focus on Health. We have learned so much about dementia. If you're watching, you can agree with me that we all are impacted by dementia, either from a loved one, a friend, a family member, a patient. If you're an employer or a community member, take Robbie up on this offer. Friends of Dementia is a free class. It's the Dementia 101. The best way we can learn and support each other is to find out more information about dementia. And she's already told you she'll go anywhere, to your church, to the community group, to the library, to the job. So contact Robbie at Area Agency on Aging. She's our dementia care specialist in Columbus and the 16 surrounding counties. She'll come to us and give us this introduction. So please take her up on the offer. And then until next time, we'll be back here with Focus on Health. Have a great day.